Myself, Dr. S.K. Aminabi, Professor in the Department of Pharmacology from the Institute of Pharmaceutical Sciences, Good Level Leru. Today I'll be discussing the topic that is congestive heart failure, and in this congestive heart failure, we'll be discussing about what is the definition, classification of congestive heart failure. Next one, what are the signs and symptoms of congestive heart failure, followed by diagnosis, pathophysiology, as well as treatment of congestive heart failure. Okay, so coming to the first one, definition of congestive heart failure. Congestive heart failure, or simply heart failure, it is a condition in which the heart is unable to pump sufficient blood to meet the metabolic demand of the body, and also unable to receive it back because every time after a systole. Okay, so that condition, it is called as congestive heart failure. Means heart is failing to perform its function. It is called as congestive heart failure. Okay, so coming to the next one, what is the classification of congestive heart failure? It is classified based on ejection factor. Whenever there is a reduced ejection factor, that is called as a systolic heart failure, and preserved ejection factor, it is called as a diastolic heart failure. And the next one, depending on the time course, this congestive heart failure is classified into two, that is chronic heart failure as well as acute heart failure. And anatomically, it is classified into two types: left-sided heart failure and right-sided heart failure. And the next one, based on the output, it is classified into high output failure as well as low output failure. That is about classification of congestive heart failure. And coming to the next one, what are the signs and symptoms of congestive heart failure? There may be dilated pupil, dyspnea, that is difficulty in breathing because of pulmonary congestion, orthopnea, that is they cannot breathe unless sitting up. There may be crackles, wheezing, cough, decreased blood pressure, nausea and vomiting. There may be edema, breathing edema, and peritoneal astrocytes, that is fluid in the peritoneal cavity, anxiety. There may be oxygen falling in, oxygen saturation, confusion, jugular vein distension, fatigue, and these are some of the signs and symptoms of congestive heart failure. Okay, so coming to the next one, how there is a congestive heart failure, it can be diagnosed. It can be diagnosed based on medical history that is being taken from the patient. And next one is a physical examination, by physically examining the patient. And next test to be performed, that is chest X-ray, blood test, ECG, echocardiogram, as well as X-ray of the inside the blood vessels, that is angiogram. Okay, so coming to the next one, what is the pathophysiology, how this congestive heart failure occurs? So we can say it, whenever there is poor ventricular function or myocardial damage, either it may be myocardial infarction or a dilated cardiomyopathy, this condition is called as heart failure. And because of this heart failure, there may be decreased stroke volume as well as cardiac output. Okay, and because of this decreased stroke volume and cardiac output, there may be neurohormonal response. The neurohormonal response is classified into two types. There may be two types of responses, that is activation of sympathetic system and renin-angiotensin-aldosterone activation. Okay, so because of that, two actions takes place, that is vasoconstriction, that is there will be increased sympathetic activity, angiotensin 2 release, and nitric oxide, impaired nitric oxide release. And next one is the sodium and fluid retention. Because of that, there will be increased vasopressin as well as aldosterone. So there will be further stress on the ventricular wall, and it is leading to worsening the conditions. So there will maybe the further heart failure. Okay, so this is the pathophysiology of congestive heart failure. Okay, so coming to the next one, what is the treatment for congestive heart failure? Okay, So various class of drugs are used. Come to the main class, that is inotropic drugs, which are further classified into three types, that is cardiac glycosides, digoxin, digitoxin, cubate, and sympathomimetic drugs. Those are dopamine, and the next one is the phosphodiesterase 3 inhibitors, that is ambreno. Come to the second class, that is diuretics, which are further classified into two types, high ceiling diuretics as well as thiazide-like diuretics. Next one is the aldosterone antagonist, that is spironolactone. And coming to the fourth class, inhibitors of renin-angiotensin system. Those are ACE inhibitors, enapramil, ramipril, enalapril as well as ramipril. And coming to the next one, angiotensin antagonist, that is losartan, candesartan, lovasertan. These are the drugs. And coming to the next class, vasodilators, that is venodilator, those are nitrates. Next class is the arteriolar dilator, that is hydralazine. The next one is arteriolar and venodilator, that is sodium nitroprusside. Come to the sixth class, that is beta-adrenergic blockers, that is metoprolol, bisoprolol as well as carvedilol. And other class of drugs, those are metabolic cardioprotectives as well as calcium sensitizers. Okay, so let us see about the first class of drug, that is inotropic drugs. And first let us discuss about the cardiac glycosides. Main class of drug is the cardiac glycosides. And the source of these cardiac glycosides, first one is digitalis, which is obtained from two species, that is digitalis lenata as well as digitalis purpurea. Okay, next one is stropanthus, which is obtained from Stropanthus gradus as well as Stropanthus combi. Next one is the squill. And other plants are Tivetia nerifolia, Nerium oleander, Convallaria majalis. And all these are the plant sources, and one animal source is Bifo vulgaris, and it contains a cardiac glycoside, that is bifotoxin. Okay, come to the next chemistry of cardiac glycosides. The cardiac glycosides, they contain sugar portion and a non-sugar portion. The non-sugar portion is called eglycone or genin, and the eglycone has a steroidal structure with a lactone ring that is attached to 17th carbon atom. And the eglycone, especially the lactone, is responsible for the pharmacological action. And what is the function of this sugar portion means it helps in permeability and fixation of cardiac glycosides on the myocardium. Okay, so coming to the next one, main one, what is the mechanism of action, how these cardiac glycosides they act. These cardiac glycosides, they mainly act by two mechanisms, that is rise in the concentration of intracellular sodium, and next mechanism is rise in the concentration of intracellular calcium. Okay, so we all know that intracellular cation is the sodium and extracellular cation is the potassium. Okay, so an enzyme called sodium potassium ATPase, it cleaves ATP, that is adenosine triphosphate, to adenosine diphosphate and phosphate. Okay, and the energy that is required for the hydrolysis of ATP is the enzyme released by the hydrolysis of this ATP, it drives sodium potassium pump, which normally pumps sodium out of the cell and potassium into the cell. Okay. Next, if however the pump is disabled due to the inhibition of an enzyme, so there will be inhibition of an enzyme sodium potassium ATPase, so there will be no exchange of sodium and potassium. So finally what happens? There will be influx of sodium due to passive re-entry of sodium inside the cell, while there will be efflux of potassium outside the cell. So the aim is to rise the intracellular levels of sodium by inhibiting an enzyme sodium potassium ATPase. Okay. Next one is rise in the concentration of intracellular calcium. Okay. Next here whenever there is intracellular levels of sodium increases, this sodium is being exchanged with the calcium. So the sodium is being exchanged with calcium, so calcium comes inside the cell in exchange of sodium, so the sodium goes out in exchange with calcium. So what happens to the intracellular levels of calcium? Increases. So whenever the intracellular levels of calcium increases, the force of contraction increases. So this is the mechanism how these cardiac glycosides they act. And now let me show the video of how these cardiac glycosides they act. Just see into this video where this is the mechanism of action. Sodium potassium ATPase is an enzyme which provides energy to the for the exchange of sodium and potassium. But these digitoxin and digoxin, they bind to the sodium potassium ATPase, so there will be no exchange of sodium and potassium. The intracellular levels of sodium increases. So there will be the next exchanger, that is sodium calcium exchanger. So sodium is exchanged with the calcium. So what happens to the intracellular levels of calcium? Increases. So whenever the intracellular levels of calcium increases, there will be increased contractility and there will be decreased heart rate. Okay. So digoxin, it produces positive inotropic action. Now let me show a video how the beta blockers they work. This is the short video regarding how the cardiac glycosides as well as the beta blockers they are used in the treatment of congestive heart failure. Hope you have understood this lecture, and thank you.